What the hell? Where am I? What is this? What did they do to me? Who are you?
Calm down, my name is Dr. Jones.
What did you do to me?
You suffered a gunshot wound, alright? We're 300 miles from any hospital, alright? There, I installed a Drivix 2000, which is an artificial heart, acts like a pump. It runs between 800 to 1200 RPM with a flow rate of 3 to 6 liters per minute, using about 4 to 6 watts of power. Right there, you'll see two knobs. That is your remote, and basically that black pack right there is actually your battery. You need a heart transplant, and this device is your bridge to it. They've done a study with 22 patients with an average survival rate of 15 months. There are three components to this device. There is the cannula, the pump, and the power source. Now the pumping unit is connected through the ventricle via the cannula, and the pump sends a stroke volume to the rest of the body through the aorta. The goal of this device is basically to assist in failing ventricles in pumping blood. Usually I'll install this device in end-stage heart failure patients, but in this case I made an exception. Hemorrhage happens to 60% of these patients. It may further contribute to complications such as hyperperfusion, multi-organ failure, and also intracranial bleeding. Around 20 to 40% of these patients will actually undergo reoperation to fix the hemorrhage. But beforehand, they would assess your past history of bleeding and look at your laboratory detected problems with coagulation. Some signs and symptoms would be tachypnea, tachycardia, decreased urine output, decreased mental status, and also prolonged capillary refill. Your immune response may be decreased when the surface area of this device comes into contact with your blood. It basically activates T cells, which are in the family of white blood cells. These white blood cells basically induce cell death. Therefore, you may be more susceptible to infection. Infection's a frequent complication with these devices. The infection usually will happen at the driveline site. The signs and symptoms would be pain, edema, warmth, and also pus. Now, it can be easily treated with basically proper wound care techniques and also with antibiotics. Now, when your device malfunctions, an alarm will usually go off to signal wear and tear. Your device should be checked annually to see if any of the components needs to be changed. Components such as the controller, the battery, and also the Y connector. You also want to have a cardiologist auscultate your heart sounds to determine any changes in the pump sounds. Now, the motor waveforms right there should be recorded to compare with normal waveforms. The waveforms would be an indicator for a possibly increased required amount of power to your device. It can also be an indicator of excess wear and tear. For emergencies, right there by your hand is your manual pump. That is for emergencies, just in case the device malfunctions. Malnutrition can happen because these devices causes a chronic inflammatory state which increases the body's metabolic needs. People are known to suffer anorexia, delayed gastric emptying, nausea, and vomiting. By walking more, you will actually decrease the chances of delayed gastric emptying. You also want to contact a dietitian to develop a proper diet for you. I have to go now, but I'll be right back.
Well, I guess a thank you is in order.
You're welcome. I'll have someone drive you to the hospital.
Thank you again.
Yeah?
He's no use to us anymore. Get rid of him.